Next, we have Ms. Nana Chinbua, who currently serves as Deputy Resident Representatives for UNDP here in Rwanda. Known for her leadership in democratic governance and peace building, Nana has been instrumental in fostering partnerships and strategic support through UN initiatives in Rwanda, including the Timbuktu Initiative, which you'll hear more about today. Before her current role, she served as the head of governance at UNDP Ghana. Nana, I'll turn over to you now. And we'd love to know more just from the experience that you've had with the Timbuktu Health Tech Hub in Kigali, which is one of Africa's 10 pioneering innovation hubs under the $1 billion Timbuktu initiative. And it's fantastic to know that Kigali actually hosts the HealthTech hub within this initiative, really showing Rwanda's commitment to revolutionizing digital health solutions across Africa and beyond. From your work experience with Africa Health Innovators and startups through the hub that you're running right now, what are the critical barriers that you see them facing in developing and scaling their solutions? Is it regulatory? Is it compliance? Is it market access? Is it technical expertise? I think from your vantage point, you get to see a lot, and we'd love to hear more from you. And then how is Timbuktu's unique venture building process really helping to address these challenges?
Thank you very much, Diane, and I'm happy to be here. Thanks for the invitation. Apologies from Fatoumata, Dr. Fatoumata, who was supposed to be here. But I think you've mentioned all the challenges that they have. Everything you mentioned is really on the list because there are regulatory challenges, because the regulations are quite fragmented. The innovators don't really understand what is expected of them. And this really leads to Dr. Phil was talking about speed. But if you don't know what the compliance issues are and what the regulations are, it really does slow down and delay the process of digital innovations. Besides the regulatory challenges, there's also an issue of market challenge. But before I move on, I don't know who was at the policy summit yesterday, but the policy summit really highlighted some of the key challenges, the policy gaps, the issue of complex licensing that we need to deal with, interoperability that you talked about. If you are licensed and registered in one African country, to be able to move seamlessly to another African country. And as Dr. Phil said, you cannot be a unicorn and not be across the continent. So you really have to be able to have that facilitation for people to be able to move from one country to the next and implement their innovations. So market access constraints is also an issue because there's limited healthcare infrastructure. And as an innovator, they really don't have a clue how to access the market. I'll talk a little bit about Timbuktu for you to know the kind of innovators we are dealing with and at what level and why these remain important challenges for them. Of course, there's also the shortage in specialized talent. Health is quite a specialized area, and how the innovators to be able to access technology, the equipment that they need, and also know there's a high cost of upkeep, right? It's quite a capital intensive. And so these are the financing gaps remain an important problem at the early stage of developing innovations. And also the high acquisition costs, and then there are long sales cycles, and then limited healthcare business model for which the innovators really don't also understand. Thank you so much for mentioning the Timbuktu Health Tech Hub. The Timbuktu Health Tech Hub actually hasn't launched yet. What we launched was the call for applications on the 27th of August, and we got about 954 applications from across Africa, actually, because this is only for African innovators. And so we are currently going through those applications, and we hope that on the 8th of November, during the Youth Connect, to actually launch the Health Tech Hub with the government of Kigali. The Health Tech Hub will be stationed in the Ministry of ICT, and so that's where their space will be. And the innovators who will be selected will do their pitching during the Youth Connect. But the Timbuktu Health Tech Hub, as you mentioned, is part of Timbuktu Africa. And the idea is to it's an innovation foundation that UNDP is setting up and looking to build partners with private sector. And the idea is to drive healthcare innovation within Africa So we want to cultivate Africa's top talent through thematic hubs. So there are going to be hubs all across Africa. And in Ghana, it's going to be Agri Hub. I remembered Ghana because I'm from Ghana. And that was the first question Anthony asked me, actually, from my accent. So there's going to be the Agri Hub in Ghana. There's a FinTech Hub in Nigeria. Kenya is going to have the Green Hub, and Kigali is going to have the HealthTech Hub. So it's going to be part of the HealthTech ecosystem that is being built, very complementary to your healthcare marketplace that you are setting up. What I think sets it apart is that we are using innovation funding. So it's more of a venture capitalist approach and granting approach. And we are also really looking for the early stage of financing. So who are the innovators at the very early stage of setting up? They have the idea. Where do they go? How do they set it up? Those are the kinds we are looking for. So the support goes beyond funding. But they are actually technical boot camps to help these young innovators on how they are supposed to develop their ideas and to scale it up to the market. So it's really an ecosystem development, but also a targeted capacity building for very, very early stage innovators, and to see how they can get the funding at that point. But we also are trying to look for those who are advanced, but only about 1,000 of them initially, to see if we can support where they are. So it's skills training, regulatory support that we provide, the business model guidance for the innovators, as well as market access assistance. So we are trying to really facilitate strategic partnerships between the regulatory bodies, which is the point you were making. You can't do it without government. So you have to have a relationship between the regulatory bodies, but also looking at how do we build more strategic partnerships with the healthcare providers, and also the global health organizations that exist, and of course, academic institutions and then private sector. But also to try and get them some very good mentors who help them along the way. It's an important part of the Timbuktu support. And our recommendations for strengthening the young innovators and to help them overcome these barriers and challenges is to look at how do we standardize compliance, really. And that is, once again, working with government regulatory institutions on how do we have standardized compliance toolkits that any young innovator who has an idea can take access it and know what the regulations and the compliance issues are for the idea that they have. We also want to share testing facilities. Can we have some facilities that these young innovators can access and is shared so that they can really test the ideas that they have? And the last 2 points is really how do we provide additional technical guidance for the young innovators and speed up the process for approval. So government, we have some work we need to do with you, particularly on regulation, fast tracking, compliance, but also with private sector, having these shared testing facilities for the young innovators will be quite critical to building up the ecosystem. Thank you.
Thank you so much, Nana. I feel like we've gotten some breaking news. I don't know if some of you were getting the same sense as I was, around what's coming up with the Timbuktu initiative. Yeah. And it's really fantastic to see some of the linkages already coming together. Yeah. So thank you again, Africa CDC, for bringing us together, because we can now see like how can we start linking some of these efforts, and how can they link and build, how can the marketplace help, like once those innovators are through your, the boot camps and the innovation systems, how can you expand their discoverability and how they can scale and how they can be found and funded. So I'm happy that these connections are already coming up. Nana, I think before I release you, you mentioned something about how there's need for that cross-cutting support system, if I could call it, to really help the innovators in the health space. And it cuts across all the spheres, from funding to regulatory to even sustainability and revenue generation also. How do you balance revenue and social impact as well? So I think there's a lot that goes there, and there's a lot of engagement, and partners also are involved. What would you say is the role of international partners in supporting health innovators?
Thank you very much. But you make an important point, and the key is the strategic partnerships, right? The SDGs has the last SDG 17 on partnerships, and the international organizations are very well placed to facilitate, bringing to, just as we have here, right? Bringing together different players and seeing how we can really strengthen that ecosystem with those partnerships. And I think that is really our key role. And at UNDP, for the UN system, we play the integrator role. So how do you really bring all the different parts together in an integrated fashion? And coordination doesn't mean we are all in a one-stop shop, not necessarily. But we're providing that guidance on how the different solution pathways can be accessed and can accessible to these young innovators. I think that is the number one most important role that international partners should play. But besides that also, we have access to a wide range of expertise. For example, we are in 170 countries, and we have this global practice network of different expertise. So all the expertise doesn't need to exist in one country. Kigali is the hub, but it's accessible to all of Africa. And we can tap into all the expertise that we have as different international organizations to see how collectively they can really provide that technical guidance that we say is missing, and the capacity, the human capacity development that needs to happen to ensure that there's a thriving ecosystem. But a lot of the international organizations are not necessarily donors. UNDP is not a donor, so we don't have huge money, but we have some catalytical funding that we provide, and of course the thought leadership, the ideas. So we do have that role, or that intelligence to also provide to the system, right? Because we can not only link up people, but we can also provide some catalytic funding to start key initiatives, to bring people together, etc. But for me, those are some of the key roles that the international organizations can play in providing support. The last part I'll say is also the policy landscape, because especially as UNDP, you were mentioning my previous role as governance. We work very closely with governments in developing, in policy development, ensuring that it's inclusive and participatory. So the key players that the policy is going to affect need to be part of the development process of these policies and the regulations to make sure that they are relevant to them, and then they have the effect that we expect them to have. So the policy framework is also an important area where international organizations can support. Thank you.
Fantastic. Nana, you have 2 questions very targeted to you. I'll let you handle those ones.
Thank you so much. To say, I found my compatriots in the room. But no, those are very important questions, because if we are not reaching the innovators we need to reach, then we do have a problem. The call for application was published in all the AU languages. As I said, Timbuktu is for Africans by Africans, right? So the whole idea was to get innovators across of Africa. We did get 9 applications from Benin. Woman King, they are roaring in your country. You need to get that vibe. But it's the application, I also, as I mentioned, is 170 countries. It was published online. There were very different modes of publications that was done. And so maybe the academia needs to expand a little bit and get on Twitter and the social media, and also look at the different websites of the international organizations to see what is happening. Because there's, as Sharon was saying, there's a lot going on, a lot of innovations within our continent, and so the opportunities are there. We just need to help harness them. Yeah, thank you very much.